country with the worst COVID-19 outbreak in Southeast Asia. And another PhilHealth executive flees the agency, this as the state insurer's top officials once again deny claims that they pocketed as much as 15 billion pesos. And lots happening with social media giants, from Facebook and Twitter restricting Trump's accounts on their platforms to Instagram's face-off with TikTok via a new feature, Reel. We begin tonight with the country's economic slump worsening in the second quarter as expected, sending us into a technical recession. Shaila Francisco tells us just how bad the damage is.
Macmac only resumed construction work this month. He's been out of work since Metro Manila was placed under enhanced community quarantine. He relied on government aid and loans for his family to survive.
Marami pa pong babayarin na mga utang eh. Kaya hindi pa sapat. Paano pag bumalik na naman po yung ECQ? Di kawawa naman kami.
He's just one of many Filipinos feeling the pandemic's pinch. The Philippine economy plunged 16.5% in the second quarter of this year, months when enhanced community quarantine was enforced. This is the lowest on record. And with 2 straight quarters of gross domestic product contraction, the Philippines formally slips into a technical recession, a first since 1991. This shrink is also the worst in the region, with 3 other Asian countries seeing a contraction. Vietnam and China saw modest growth during the period. While agriculture grew in the second quarter, industry and services pulled down economic performance, particularly in accommodation, food services, transportation, arts, and recreation. All were put on hold during ECQ. Household spending also declined. But things could have been worse, according to Finance Secretary Sonny Dominguez. If not for the boost in public spending, he said first half GDP could have sunk to 11.5% instead of 9%. Economic managers see full-year GDP to shrink by 5.5%, lower than the initial forecast of negative 2 to 3.4%. While the reimposition of MCQ may have repercussions, Dominguez said it's a much-needed move.
If we don't do it and more people get sick, that's going to be worse for the economy in the long run.
The National Economic and Development Authority is seeing signs of recovery in manufacturing and trade. The government is also relying on the Build program to sustain economic activity. They retained 92 infrastructure projects and shelved 8 projects which are still under feasibility study.
When needed, we will have to take one step back, and when the virus is more contained, then we will proceed with more relaxed quarantine measures.
Economic managers are banking on the second Bayanihan bill, which they expect to be passed next week to aid the country's crisis response. The proposed 4.5 trillion peso 2021 budget will also help sustain state efforts. Shaila Francisco, VR1 News.
Malacanang says government is working hard to get the country onto the recovery path. Pala spokesman Harry Roque said government is also expecting improvements in the second half as the economy reopens, especially in the manufacturing, construction, and transportation sectors. Congress is now being urged to fast-track the passage of Bayanihan II, supposedly to boost funding sources for pandemic response and recovery. Speaking of which, Bayanihan II is now one step away from getting passed in the lower house. The amended version hurdled second reading via viva voce. It allots 162 billion pesos as standby fund for COVID response. This is higher than the Senate's 140 billion peso version, but that revised amount, said House Deputy Speaker Relivier, is still not enough.
However, para matugunan ito ng mabilis, we want to pass this measure and find other means how we can raise funds with the existing economic conditions.
The Makabayan bloc is echoing the same sentiment. Bayan Muna Party List Representative Ferdinand Gaites said that 162 billion pesos are just crumbs and would not do much for recovery.
Malinaw na napakaliit ang halagang inilalaan. Recovery na dapat to. Unlike itong Baho 1 na supposedly healing na hindi naman nag-heal. Ngayon recovery. And recovery, mas kailangan na mas malaking gastusin para masuportahan.
All Filipino seafarers who went missing after the explosion in Beirut are now safe and all accounted for. However, the number of injured Filipinos has tripled since yesterday. Marian Enriquez with the story.
OFW Ursula Gira sustained wounds on her face and arm from the massive explosion in the port of Beirut, just 5 minutes away from her employer's home.
Basta ang alam ko wala na ako noon, natapon ako na hindi ko na malayan. Kasi malakas yung pag-impact, yung dinig mo talaga yung dinig mo.
Dripping with blood, she tried to walk to a nearby hospital, but because it was full, she had no choice but to head back home and remove the shards of glass by herself using a first aid kit.
Kaya.
Her daughter, who is a nurse, assisted her via Facebook. It was only the following day when she was finally attended by a medical professional.
Pinahinga yun na 10 stitches. Medyo lumabas kasi yung laman niya.
In her 9 years as a household service worker in Beirut, Ursula said this was her first time to experience such a terrible explosion.
Hinihingi ko na lang is makauwi na lang ako. Kasi talagang hindi pa naman siguro ako kung saan nanggaling yung pagsabog na yon, which is may bali-balita na una pa lang yun, may susunod pa.
She's not alone. 29-year-old seafarer Nestor Enrera, one of the crew members of MV Orient Queen, wants to be repatriated.
Pagtalikod ko po, yun na po, sumabog na po yung pinakamalakas na sabog po at tumalsik po kami doon sa pinagkakatayuan namin hanggang doon sa dulo nung nung pagtagising ko po, medyo nawalan po ako ng malay. Sa basurahan na po ako na gising.
He said they were trapped and needed to jump from the ship's deck to the port's platform. Fortunately, a fisherman brought them to a hospital. Nestor suffered minor injuries. They were picked up by their employer and housed them in a hotel. The Philippine Embassy in Lebanon gave them food and clothes. All the 13 Filipino seafarers from the ship were accounted for. 5 of them are still in the hospital. The cruise ship had now partially sunk next to the pier. They also asked the embassy to help them with their delayed salaries since February.
Nagka-problema po kasi dito sa Beirut. Nagkaroon sila ng crisis dito. So hindi sila makapagpadala ng pera sa amin.
The Philippine Embassy in Beirut says the number of injured Filipinos has climbed to 24, while an OFW is still missing.
The Philippine Embassy in Beirut assures the public that they are still assisting the OFWs not just with the recent Beirut explosion, but with their mass repatriation program. The embassy's charge d'affaires Ajit Panimanglor said some OFWs are seeking repatriation after receiving low wages due to the ongoing economic crisis in Lebanon. So far, more than 2,400 OFWs have been sent back to the Philippines.
Yung major reason po kung bakit maraming gustong umalis is because of yung economic problems dito sa Lebanon. So not so much yung yung any issue sa security ganyan, but economic problems.
We'll pause for a short break, but when the big story returns, the country now has the most number of COVID-19 cases in Southeast Asia as infections close in on the 120,000 mark. But the country's testing chief is downplaying the steady increase in cases, saying it's all natural. And the government has launched its One Hospital Command Center to improve the referral system among hospitals in the country. The details after the break. I'm Robbie Alampay. You're watching The Big Story. The Philippines now has the highest COVID-19 case count in Southeast Asia with close to 120,000 infections as of Thursday. That surpasses the numbers in Indonesia. More than 3,000 new COVID-19 cases were reported today. As it stands, there are at least 50,000 active cases in the Philippines. Casualties from the virus have reached more than 2,000 with an addition of 28 deaths. Meanwhile, over 500 new recoveries were tallied today. That pushes the total number of recovered patients to more than 66,000. Despite the continuing rise in cases, the country's testing czar says it's all natural, especially with the boost in testing. Workers are also being advised that offices might actually be the most critical areas for transmission. Camille Samonte explains.
Active COVID-19 cases in the country has gone past 50,000 as of Thursday. That tops other Southeast Asian nations, with Indonesia at a far second with more than 37,000. The Philippines, as reported by the Straits Times Singapore, might just very well be on its way to becoming the new epicenter of the pandemic in the region, making the two-week MECQ in Metro Manila and nearby provinces all the more crucial, at least according to an infectious diseases expert.
Pag nag-lockdown ka, dapat din vigorous din yung contact tracing, vigorous din yung case finding, testing, including monitoring in the workplace. Kasi ang nangyari kasi pag nag-lockdown ka tapos hindi mo naman gawin yun, walang mangyayari niyan. Pag i-open mo yun, then you're also opening more infections.
But the steady increase in cases is but natural, since COVID-19 Deputy Chief Implementer Vince Dizon, especially with a higher testing rate compared to our neighbors.
What the data shows us is that since we ramped up testing, we have found more positives. And our people have to understand that that is normal.
COVID-19 Chief Implementer Secretary Carlito Galvez Jr. said workplaces in economic hubs and informal communities are the most critical areas for COVID-19 transmission. That includes canteens and smoking areas where some fail to observe minimum health standards. Dr. Solante warned that employees should not be complacent even after testing negative for COVID-19.
Pag sinabing negative na ako sa RT-PCR, okay na ako. Yes, okay ka makapagtrabaho, but you should also still practice the health protocol. Oy, negative, positive ako sa antibody. It doesn't mean na wala kang infection or hindi ka mahawaan.
Galvez urges private companies to conduct compliance orientation seminars for workers. He likewise said that there's been an alarming trend of transmission via family reunions. For News 5, Camille Samonte, we are One News.
Biotech firm Nucision wants to not only join but disrupt the COVID-19 treatment race with a drug called Relivier. The company, composed of a team from the United States, Europe, and the Philippines, says Relivier is a first of its kind as it disrupts the virus replication. Nucision says it can be delivered intravenously or through an inhaler, but they're focusing on the IV method as it is supposedly shown to take effect faster. The company is now preparing for a series of tests on Relivier and its efficacy as a COVID-19 treatment.
In a couple more weeks, we should wrap up the first level of the first batches for our testing. We will then initiate and engage in animal studies and toxicity testing. And obviously we've been working with the Philippine agencies there to prepare for human clinical trials.
With more than 150 government agencies under lockdown, labor groups are calling for free mass testing among government employees. Adding to their worries is PhilHealth's claim that funds will last only a year. The group Calacon said the government's contractual employees cannot afford swab testing and other treatments without PhilHealth. Labor group Courage said the state should ensure sufficient allocation for public health.
Trilyon ang inutang ng pamahalang to sa iba't ibang sources. Hindi pwedeng sabihin na kulang lagi po. Arte-arte na. Wala na tayong pondo. Ba't ang Vietnam? Bakit yung ibang mga bansa mas mahirap pa sa atin kayang rumisponde?
With more hospitals reaching full capacity, the government has launched a centralized program to refer both COVID and non-COVID patients to medical facilities. Jenny Dongon tells us how that works.
20-year-old Diane Villegas complained of severe stomach ache last August 4. She was rushed to the nearest hospital but was refused admission. The same thing happened to 4 other hospitals. The family had no choice but to return home because Diane was already weak. The following day, Diane collapsed and eventually died. Since she was not brought back to the hospital, the cause of Diane's death remains unknown.
Ang explain po sa amin, puno na po daw sila. Baka daw maano yung bata, hawa daw, baka magka-COVID lang daw.
Paano na po yung hindi COVID patient, ma'am? Ang tanong, saan tatakbo? Diba? Kung hindi ka COVID patient, saan ka tatakbo? Kung kailangan mo ng doktor, kailangan mo ng malaking ospital, sinong lalapitan, ma'am?
UniHealth Hospital in Parañaque denied the allegations of refusing admission for non-COVID patients, though the hospital confirmed that they have reached full bed capacity.
Ma'am, sa totoo lang, walang araw na hindi kami puno pati ER. Walang araw. Ang lineup namin, ma'am, ay nasa mahigit 100.
The incident is now being investigated. With more hospitals declaring full capacity, the One Hospital Command Center was launched on Thursday. This is a centralized system that aims to refer COVID-19 patients to hospitals that can attend to their needs. Public and private hospitals will regularly submit data like bed capacity to the Central Command and match this to the patient's needs. Patients may get in touch with the call center of OHCC for referrals.
The hospitals here in Manila are, especially the wards and the isolation, if you take a look at the dashboard, talagang mataas yung admission rate. But if you take also a look in terms of the admissions, most of this, about more than probably 60% or even 70% of this, are really admitted for mild and asymptomatic cases.
Currently, the country has a 1,700 bed capacity for isolation, but 1,400 of these have already been occupied. Dizon said they will top more hotels to boost capacity to 3,000. They are also planning to add 3,000 more beds at the Wihil as One Center in Manila on top of the existing 3,000 units. These facilities are being used for the isolation of mild and asymptomatic cases to decongest hospital, especially in Metro Manila. For News 5, Jenny Dongon, We Are One News.
Metro Pacific Corporation is reporting a 60% earnings cut in the first half of the year as the crisis has hit all business segments. Core income plunged 38% to 5 billion pesos, while consolidated revenue saw a 17% drop to 30 billion pesos. The company's toll road unit was the hardest hit as vehicle volume and expressways declined after non-essential travel was prohibited. The company's utility units were also battered after a significant drop in commercial and industrial demand. The company says it remains committed to taking up projects with government geared towards recovery, but not to the extent of taking additional leverage on their part. PLDT, for its part, will be allotting 70 billion pesos for network expansion this year, lower than its original Capex plan of 83 billion pesos set back in May. The telco giant's second quarter profit rose 16% to 6.4 billion pesos. Data and broadband revenue also rose double digits to 59 billion pesos as lockdowns forced stay-at-home arrangements. Meanwhile, TV5 Chairman Manny V. Pangilinan has reiterated that they are ready to absorb some of the displaced workers of media giant ABS-CBN after its franchise ended. The TV5 Chairman added that they will do what they can to employ directors, scriptwriters, cameramen, and other behind-the-scenes crew to provide employment to the laid-off workers.
There are ongoing conversations with their talent. So but it's not as how would you call it? It's not as expansive as one would assume, because una we're careful about any contractual arrangements these talents have with ABS. We respect whatever arrangements they might have with their mother studio.
Coming up on the big story, PhilHealth denies accusations that senior officials of the agency pocketed 15 billion pesos of its funds. And looks like a competition is brewing among short video making apps. Instagram just launched Reels, a lookalike service of hit app TikTok. More details when we return. This is the big story. I'm Robbie Alampay. PhilHealth Senior Vice President for Operations Augustus De Villa has resigned from his post. He submitted his irrevocable resignation earlier today after a meeting with PhilHealth Chief Ricardo Morales. De Villa says he will make himself available for the ongoing probes into the alleged corruption within the state insurer. Meanwhile, Senator Francis Pangilinan says all senior officials of the state-run insurer should resign out of delicadeza. PhilHealth is strongly denying the allegation of its former anti-fraud legal officer that senior officials pocketed around 15 billion pesos. It is also denying claims that PhilHealth's IT project is overpriced. Rio Fernandez tells us more.
PhilHealth officials are now denying the slew of corruption allegations against them. First of which is the accusation of resigned anti-fraud officer Thorson Keith that they pocketed 15 billion pesos. The Execom members are determined to sue Keith for libel.
Hindi niya pwedeng i-invoke yung legislative immunity niya kasi PhilHealth kasi can sue or may be sued as an entity. Ay ang members ng Execom on our personal capacity will file cases.
As for the controversial overpriced IT project, they said it went through due process.
Yung sa allegation po ni Mr. Cabadin na yung ICT budget proposal na 2.1 billion in December daw po was rejected by the board because it lacks specific detail, ay hindi po totoo. Ang nangyari po doon noong December 15, regular board meeting, the board agreed to defer the approval of the 2020 IT budget.
Aragona also belied claims that the Cisco network switches were overpriced. She said that their computation is higher as it includes costs for other specifications. Meanwhile, PhilHealth President and CEO Ricardo Morales said that he understands the decision of SVP for Operations Augustus De Villa to resign.
It's not easy to be running PhilHealth even in ordinary times. And also, lalo na sa panahon ito, we're subjected to a 10-hour grilling by the Senate. And I think we're really, talagang nalasmag kami doon.
And despite call for his resignation, Morales said he's not stepping down, confident that the president still trusts him.
Retired na ako nung pumasok ko dito I mean, I was living a happy, carefree life.
Morales said they will continue to reform PhilHealth. He said the forensic audit should get to the bottom of the 154 billion peso overpayments. He expressed openness to the investigation and filing of charges of the Presidential Anti-Corruption Commission against PhilHealth officials allegedly involved in irregularities. He assured PhilHealth members that there are enough funds in the state-run insurer and that the actuarial study was just based on assumptions. He said PhilHealth will run out of money if and only when the government can no longer provide for it as its reinsurer. For News 5, Ria Fernandez, We Are One News.
A PhilHealth official is downplaying possible charges being recommended by the Presidential Anti-Corruption Commission. Commissioner Greco Belgica said that at least 36 PhilHealth officials are set to face charges over supposed padding of hospital claims to the state-run insurer. But in an interview with the chiefs, PhilHealth spokesperson Shirley Domingo explained that there are system inefficiencies that the agency cannot do anything about. With classes set to resume in 2 weeks, some parents and teachers are still calling on the Education Department to postpone the start of the school year. Their concerns in this report by JC Cosico.
As a single mother and a professional, Bethel Hernandez can't help but worry. The school year is about to start in a few weeks, and she's uncertain if she can give her 2 kids enough time to assist them under the modular learning setup.
Yung pagbalanse ng oras, ngayon ay focus pa ako din sa work ko. But when my kids' schooling start on August 24, medyo bagong adjustment na naman sa akin yun.
This teacher, who wished to be identified as Ruth and not her real name, has a different concern. She says she will physically collect hundreds of worksheets weekly from her students as part of the new setup. She's worried that her negative COVID-19 test result might be for nothing.
Magdi-deliver ka at saka magre-retrieve ka ng mga materials. Anong kasiguruhan na virus-free yung mga materials na mapupunta kay teacher?
Adding to her worries is her internet connection. It's low, and her 3,500 peso yearly chalk allowance is not enough to pay her internet bill.
Sa ngayon pa lang, nagja-jam na ang signal sa pagsabay-sabay na paggamit ng internet. How much more pagdating ng pasukan, diba?
Education Undersecretary Diosdado San Antonio urged schools to be creative and gathering modules so as not to risk their lives for the job.
Pwede naman itong parang drop-back system na lang katulad ng ginawa sa enrollment.
But if left without a choice, he reminded them to just observe minimum health standards. The official also clarified teachers are not required to have network connectivity.
Yung walang access sa internet can use other means. Yung digital na mga flash drives ang gagamitin mo kahit wala kang internet. Pag may access ka sa yung digital copies na nalipat sa flash drives o mga CDs, ay pwede mo nang mabuksan yung iyong mga ituturo.
But these explanations did not convince the alliance of concerned teachers.
Ay kawawa na naman ang ating mga kaguruan na sila na naman yung mapipilitang gumawa ng kung ano-anong mga pamamaraan para lamang maitawid yung pagbubukas ng klase.
They are urging DepEd to postpone the August 24 school opening. For News 5, JC Cosico, we are One News.
And here are some of the big stories around the world. Facebook, Twitter, and YouTube took down certain video posts of U.S. President Donald Trump due to misinformation. The video clip contained an interview with Fox and Friends in which Trump claimed that children are almost immune to COVID-19. Trump's campaign team accused the companies of bias and insisted that Trump stated facts. The Centers for Disease Control and Prevention has said that some children and infants have contracted and transmitted the virus. It looks like Facebook is trying to dethrone TikTok. The company's photo-sharing app, Instagram, just debuted its short video-making feature called Reels. The feature arrived while TikTok is facing threats of a ban in the United States. TikTok's chief executive dismissed Reels as a copycat. And that wraps up today's big story. Catch us again tomorrow at 8 p.m. on Signal Channels 8 and 250. Please like our Facebook page, One News. For more in-depth analysis, visit our webpage, onenews.ph. You can also catch One News on the Signal Play app. Register for a free account now at signalplay.com and stream One News live anytime, anywhere. I'm Robbie Alampay. We are One News. Good evening.